Hello everyone, I am Lance Wilkerson and I'm again here at Deaconess Clinic downtown with dermatologist Dr. David Surprenant, and we're going to talk about skin cancer, and unfortunately it's something that's pretty prevalent, especially in our area. But we'll start with a generic question: what is skin cancer?
Yeah, so skin cancer, it's really an epidemic nationwide and really even worldwide. Skin cancer is when you get abnormal cells on your skin that just grow out of control. And these cells can come from different structures, so your normal skin cells, which is called the epidermis. Those keratinocytes are the cells, and they can just grow haywire, and they're no longer regulated, and they just grow, and they can invade, and they can spread to other parts of your body, and it can be serious.
So what is the causation for most people? I think of skin cancer, I think of sun and the protection of that, but what are some of the ways that happens to people?
Yeah, so a large part of it is your UV exposure, so being out in the sun. Even if you're not out, working outside all the time, everyone's driving in the car, everyone's going outside walking at some point of the day, and it doesn't necessarily take a whole lot of UV exposure in some cases. Some of it is your genetic predisposition. So if you're a redhead, if you've got fair skin and fair eyes, you're a much higher likelihood of developing one of these skin cancers.
With all cancers, finding it early is so important. So what do you tell people on self-check?
Yeah, that really is hitting the nail on the head with skin cancer. Catching it early is really the name of the game. And if you catch skin cancer early, it really is not a big deal, and we can essentially cure you, and you can move on with your life and not worry about things. If you catch it late, we can have some poor outcomes. But it's important just to be aware of your body. I think some situational awareness is the most important thing. And if you have a spot that's new or changing, or a spot that's bleeding, that isn't healing on its own, that's a cause of concern and should be looked at a little bit closer. So a common scenario would be somebody who's shaving their face and feels like they keep nicking the same spot. You shouldn't be nicking the same spot every time you shave, and those non-healing spots can be a sign of something a little bit more worrisome.
And one of the impactful things that Dr. Surprenant brings to the table for our community is MOHS, M-O-H-S. Kind of explain that.
Yeah, so MOHS, micrographic surgery, is a technique that was developed by Frederick Mohs, Dr. Frederick Mohs. He was out at the University of Wisconsin back in the 1940s or so, and developed this technique whereby we can remove cancer in a very precise manner. And essentially what we do is, patient comes in to see me with a cancer. We remove just what we see, so we don't take a large margin of normal, healthy skin. We just take out the cancer. And then I have the capability of processing that in a very kind of unique way, where it's put on a microscope slide for me. About 90 minutes later, after we remove it, I can evaluate it under the microscope. And I can evaluate the entire margin. And what that means is I'm looking all the way around that cancer I removed and all the way underneath it. And I'm making sure that there's no skin cancer left behind.
Wow, that is a lot of great information right there. Really appreciate it. And if you need a dermatologist, Dr. David Surprenant is accepting new patients, so you can have your primary care physician look for a referral there. You can go to deaconess.com/findadoc and enter his name in there, or call the number on your screen, 812-426-9371, or go to deaconess.com/dermatology for all your questions there. Well, thank you a lot, Doctor. Really appreciate it.
Thanks, Lance. Appreciate it.
I'm Lance Wilkerson. Have a great rest of your day. Thank you for watching.